Well, first of all, my apologies for being a couple of minutes late and being a little frazzled setting up, but I am very honored to be here, and I really appreciate Blair inviting me to come and speak with you guys. I don't have a ton of experience with transgendered treatments, but I think I have a very good artistic eye, and I really have a very deep passion for this. So first, I have a very deep passion for my work. I really believe it's my life's mission of what I do. It's not a triviality, it's not superficial. I love what I do. That's the first and foremost thing. And the other thing is that I really have a heart for people that are in a situation where they want to get better and where they want to feel congruent with where they are inside. It's been a huge part of me. I've always felt like an outsider as an Asian growing up in the 80s in Texas, and I've really come to accept myself now, and I'm really here to be that, hopefully that voice to work with you to get yourself where you would like to be. And my third passion is really to transform lives in general, just to help people be who they can be. And so I want to start with that. Really, we have to first understand what defines a masculine face and a feminine face. And when you put them side by side, there are a lot of salient hallmarks that make them very different. And I think that you probably already, through your research and some of the procedures you've had done so far, understand those differences. But I want to start with that framework, which is the idea that the face, one is a little bit squarer in nature, and the other one is rounder and softer in nature. One has harder edges of bone, and the other one is softer, has more soft tissue present. And if you think about this, we're going to talk a little bit about the face in a moment after the hair, is that the softness for the female is a lot to do with the soft tissue envelope that's there, that we can cover some of that bone. And if you think about what is more feminine is a more youthful state. And so we're going to talk about some of those concepts, and hopefully they have some resonance with you and some ideas that make sense to you. But also, if you look, the hairline is also markedly different between a male and a female hair shape. It's rounder here in contour versus straight. Same thing with the eyebrows. If you look at the eyebrow, it's a rounder contour versus a straighter lower profile. So there's these angularities that are there, both in terms of bone as well as in terms of hairline shape, etc., that are there that we want to strive for. So we're going to first talk about understanding what constitutes a female hairline, because there's so many variations, right? There's not a cookie cutter, one size fits all paradigm. And so I want to walk you through some ideas. If you look at this shape, it's a very oval shaped hairline, and then there's this central whorl that goes across. So the hairline for a gentleman and a lady is very different. For a male, they tend to go straight out this way. And for a woman, there's more of a whorl coming out. So there's a different way of designing it altogether. And this is another variation. As you see here, there's a more pronounced central widow's peak. And so I can design a hairline based on your facial features, based on your desires, and also based on maybe some concepts that you really want to have. And if you see the arch here, it almost makes like a heart-shaped design. And then finally, this is another one. This is actually Amina, Blair knows. And this is a sort of a more rectangular shape with more of a diffuse whorl and a diffuse cowlick. So these are ideas that there's variations there, but there are certain hallmarks that are very, very different for a woman versus a man. And if you see here, this is a hairline that is more masculine looking because it has had some loss across here, and this is redesigning it, obviously some color as well, to blend it out and reframe the face in a feminine way. I think this one is more pronounced. You can sort of see more of a masculine type shape contour, and once you shape it right, it completely feminizes the face and creates a better arc and shape to the face that's there. This is another example where this can look like a masculine hairline, and when you shape it in a certain way that's beautiful, it can look really, really good. Interestingly, today I just worked on a MTF transgendered patient that came in from another city, and I wanted to show this. I hope it's not too graphic. You guys are eating. If it is, don't look. But this is the scar from the advancement that was done, and if you see, it's still a masculine shape. And we're going to talk a little about the differences in a moment between the two. But this is my canvas where I'm designing it, and you can see the feathering pattern I've done, the whorl, the little bit of a widow's peak, and then the shape coming down like this, a little bit out of focus. That is, in my opinion, a much softer look. And this is what's so fun for me, is that hair is not boring for me. It's not just an exercise in sticking some grafts up there. And my real passion is design. I actually get a high on designing it. And this is what after each procedure on the computer, and this is from today actually, how I've designed it. You know, with central density, I've looked at the whorl pattern across here, the greater number of one-hair grafts, and all these are just technical verbiage to talk to you about how this is sort of like my, if you will, my masterpiece. In other words, I really enjoy this. It's like something I have a deep passion for. And this is someone familiar here. And this is and this is an earlier result for Blair, where I don't think all the grafts have grown in all the way, but you can sort of see.
The first one was me back in what, 08?
Yeah, that was starting out exactly when the first photo. I don't remember exactly when it was.
So I came to Dr. Lamb and I go, hey, I'm on hormones. He goes, what? And I go, I'm gonna transition. So he goes, well, come in here. So he goes, well, I'm glad you told me that. So I've had 3 now.
Yeah. Yeah. I think it's a softer look. It's a more feminine look. It's a natural line, because I've created the whorl pattern that's more of a feminine look. So to contrast it, because there's 2 ways to restore hair that you may be familiar with. One is a surgical advancement, and the second one is a hair transplant. I think it's really important to differentiate the pros and cons of each one, because there are definite pros and there are definite cons of each procedure. If you do the advancement, the big pro is it's a quick procedure. You can move it right up fast and forward. You don't have to wait 6 months to see a result. It's there. The other pro of it is that if you're going to do any kind of brow contouring or lifting or things like that, it can be done at the same time. So clearly that's another big pro with this. Some of the cons that you may not think about are the fact that you really can't design the hairline. If you take a masculine hairline and you move it forward, it's just a masculine hairline moved forward without the articulation of the feminine shape that's there. So that's one thing. It's a subtlety, but my work is about subtlety. It's about understanding that subtlety and designing it in such a way that it looks pleasant and looks good. So that's one concept that I think is out there that's important to understand. The other thing that's really important is when you do a surgical advancement, you're only advancing the hairline. You're missing half the frame. Remember that in my design that I showed you with the lady, it's rounded, and you can only get the front part done. So if you've had an advancement and it looks good, I can easily frame it around there and blend it out. In fact, that's what I did. I showed you in that last design piece exactly that. So, and also, as you would understand, if you have crown loss, you have other losses, the advancement's not going to really address that issue. So to me, it can complement an advancement, it can replace an advancement, but almost every advancement you do is going to require some degree of finesse or refinement, in my opinion, to get the optimal results that are there. Okay, so hopefully that was helpful. Again, if there are any more Q&A, I can go through that more in detail. So the other component here is back to the eyebrow. I've done 2 this week, so, you know, just for different reasons. But if you understand, you say, well, why would I want to do an eyebrow? This is going to really be more probably FTM when you're dealing with, if you think about it, you can, if you have a hairy eyebrow, you can pluck it like a lady would pluck an eyebrow. But sometimes if you want to change that feminine eyebrow to a more masculine quality, you need to actually lower it. And this is an example of a gentleman I did where I was able to take that brow and thicken it across there and strengthen it so it's a lower, straighter contour that hugs the bony contour of the orbit. So that's sort of something that you may not have thought about. And one of my patients had asked me, he says, look, you know, we're looking for all different things. Don't just focus on, you know, a transplant. Talk to us about other things that we may not even entertain in our mind. And so that's, yes, question?
So where's the donor hair coming from for that?
The best donor hair is from the back and usually right here toward the temple. You want to find the finest hairs that are there with the least degree of excessive curl. And then you want to find the hairs that are one hairs only. So I'm very selective in picking the right hairs for that.
So you do
yeah.
eyebrows?
Yeah, I do a ton of eyebrows. Yeah, I've done 2 this week.
Discussed that last week.
I'm sorry, I apologize. I didn't, but these are things that, the negative of an eyebrow that you need to know is that you need to trim them every week to 2 weeks as if you're trimming your own hair, because it's growing faster. Sometimes after about a year, there's something called recipient dominance, which means that the hairs start to slow down. They don't grow as fast, but I can't promise you that. We do give you a little eyebrow scissors that are really, really easy to use to do that. So yeah, eyebrows are, to me, the highest form of art. And I love doing them because you can really create the shape. If you understand how eyebrow works, there's this arch, and then there's this curve that goes down, and then what's called a fishbone or herringbone, where you see the cross hatching going down to the edge. So that's something that's really, really elegant and very attractive, I think, in both genders. This is the, yeah,
So,
sorry.
Dr. May, if you let that go
Yeah.
long enough, you could theoretically have eyebrow dreadlocks.
Yes, well, that,
Could.
you know, if you want a Rastafarian look, that's absolutely,
Okay.
you know, that's an artistic choice. So the other concept is understanding facial and body hair transplants. A lot of people look at this as something that is a good adjunct to framing the face, because to me this is the lower facial frame area, and the key with this is really making sure that the angles follow a natural shape. So what I want to do when I'm doing this is really maintain a very, very low angulation to the hairs, because that's what's natural. Same thing with eyebrows. So anything from basically from here down, you want to keep a low angulation. And this, if you look at the natural pattern on a chest, you want to emulate that. This typically takes about, it can take quite a few, depending on the chest size, between 2,000, 3,000 grafts, whereas this can be about 1,500, whereas like an eyebrow would be 300 to 400 a side. So just to give you an idea, and if you're doing what we do mega sessions today, we can actually move, I can tell you this now, we can move 2 of your sessions in one. We've gotten a lot, we can move about 3,000 grafts in a single session called a mega session, and it is tremendous what we can do. I want to spend a few minutes and talk to you about what we do differently, and for me it's 3 things. It's craftsmanship, it's use of technology, and it's design, and that's what really lends itself toward a good transplant result. So I want to talk about craftsmanship. I'm not going to bore you with a ton of details, but the reason why the reason I'm so good is not because of me, it's because my team is excellent. And when you're doing a hair transplant, you really have to have, I'm sorry, I blocked everything off here. When you do a hair transplant, you have to have a quality team, and you know how great Amina is, you know how great my whole team is. Sorry about that. My team is fantastic at doing great work, and so they, you know, Amina's won Surgical Assistant of the Year award. She's done it for 23 years. She's actually a physician from another country. So what that means is every graft that has to be dissected perfectly and placed without trauma leads to a natural result. If the grafts are traumatized during insertion or they're placed too deeply, you'll get pitting, you'll get grafts that don't angle well. So I can do the most beautiful design work, but if the attention to detail and taking care of each of those grafts are not done with absolute finesse and perfection, your results won't look good. And we're not talking about plugs. Those are gone since 1989. We're really talking today about just not having the attention to detail toward excellence. And all my staff, they're never outsourced. They're with me full time. They're 5 days a week, and so you're going to get always an A-quality team. We always do 1 procedure a day, so that it's really, to me, I liken it to a boutique environment. We're there to create excellence. We really, all my staff, and I believe if you can attest to this, are as passionate as I am. It's not like, hey, here I am, I really love what I do, and hey, you got this doctor who's gung-ho for what he does, and you got the staff that are about bleary-eyed and about to fall asleep. No, they love what they do, and to me, that's huge. You know, for me, I'm an artist. I love designing, and I get up in the morning just absolutely excited to go to work because I love designing. And to me, this is art. And so I love shaping things and designing things. We're talking about the face in a moment as a compliment to hair. But for me, you know, I know my colleagues look at hair as boring. You just stick stuff up there, and they go to work, you know, without any passion in their eyes. But I love this. I mean, what I showed you, that design that I just showed you a moment ago, to me that's fun. I mean, this is not going to work. I mean, even my talk tonight is not here for work. I mean, I love giving talks. I'm giving talks about every month nationally, if not internationally, because I love communicating and educating about what I do for even my own colleagues or for you. Technology is the last part of the pie, and it's something that we tend to overlook because unfortunately about 99% of physicians out there don't have don't really think about technology as being important. What is technology? Well, we've got robotic hair transplants, things like that, but that's not what I'm talking about, which we do have actually. It's a beautiful instrument for what's called FUE, meaning no incision. But really what I want to talk about is using things like PRP, platelet-rich plasma, ATP, A-cell. You go, what is all that garbage that you're talking about, that verbiage? What all that means, I liken it to a very, very easy word, fertilizer. If you think about it, when you put grafts in, no matter how good you are technically, if you don't have the fertilizer to help it grow, sometimes no matter how good you are, the grafts don't grow as well. And so I have really, really good fertilizers, and I believe, to me, since October 2011, I've been doing this, and it's been a transformation in my practice. I get a much more consistent result, faster healing time, faster graft growths. All those things are tremendous. So something I'm very passionate about. I believe that technology must be married to old world craftsmanship to get great results. So that's a short talk about hair, and I think it may be better if I answer some questions after I get through the face part. Let's go back to the face. Remember that the facial shape is a huge part of this design work that's important. And I believe that if you think about what aging is, aging actually is the change of a more feminine face to a more masculine face in many respects. Sometimes you know, men look better with a little bit of aging, and women don't look as good. So a large part of what I'm trying to design when I'm looking at feminizing a face is also making it more youthful in many respects. And sometimes for men, to make a, you know, if we're talking about FTM, we have to make a design that's going to be a little bit softer, a little bit stronger in the right places, but it may be something that has to be more delicately discussed so that we get the right desire of what we're trying to achieve. So I want to go back to that shape, and I want to talk about the transformation that occurs over one's lifetime. Just in general, no matter what your gender is, no matter what your orientation is, we go from a very full circle, okay, to a transformation where it becomes more of an oval, and then it starts becoming square and square and square. And so if you think about it, when I'm designing for a more female face, I'm shooting more for this shape. And when I'm designing for a more of a masculine shape, I'm designing for this shape. And these are just some of the ideas that you don't think about this. It's not just gender, but it's also that change of gender over a period of one's lifetime and what I'm trying to achieve with that based on this concept of aging. So what I try to talk about is the concept of blink that Malcolm Gladwell talks about, which is how do we read each other's faces in a blink of an eye? What makes us look at a face and register it as feminine? What makes us register it as masculine? There are certain elements that are there. And what I talk a lot about is light, because what light does is light comes down from above. And so that shadow effect that occurs on the face can either masculinize us or feminize us. And so all my photography is done without flash photography. It's done with natural lighting, very controlled, no ambient light, same camera, same distance, everything is rigorously controlled. So with aging, what happens is that the face actually deflates. So I'm not a gravitational person except when you're in your 50s and there's more neck issues. But in the terms of the face, there's a colleague of mine out of Los Angeles who's actually looked at men and women in their mid-60s, measured what gravitational component is in this area, and found that there's almost none. And if you go back and look at photos, I mean, obviously you've gone through some facial changes, but if you look at your photos in youth and we think, you know, women have high brows, I completely disagree. If you go look at, you know, models of feminine beauty, which, you know, you could use the textbooks, Glamour, Allure, and Vogue, and look at them, they don't necessarily have a very high arch brow. It's a preconceived notion that we need a brow lift. This is why I've abandoned brow lifts for 8 years. If you want to feminize a brow, you don't need to elevate it. You need to fill it in. And if you want to masculinize a face, I'm going to talk about some concepts about facial shaping where you can actually do soft tissue augmentation and make it look like hard tissue. So we're going to get there in just a moment. So that's the concept of aging, is deflation. And so if you look, this face right here, it looks like these are falling, right? But if you look at the brows, they haven't fallen. Look very carefully. They haven't fallen over 20 years. If you look at the skin on her right, your left, it's come down a little bit. But on this side, it's actually gone up. So what this aging process is that has masculinized the face is volume loss. It's a loss of volume. And this is one thing I'm very passionate about. I wrote a book on this about 7 years ago on fat transfer. And to me, it's a beautiful way to feminize a face, whether it's through fat or whether it's through fillers. And I've got so many techniques now, which we can detail more in maybe in the Q&A time. But I just want to go through concepts, because if we don't get through the philosophy and the artistry, we get bogged down in the details. I want to take a step back and have you conceptualize what beauty is and what is feminine about it. And this is a large part of it. If you look at this face here, this is just a lady, not transgendered, but if you look, she looks more masculine, because she's in her 50s. And what I've done is I've feminized her face because I've just softened those attributes, and that's with the fat graft. Since October 2010, I've been using something called a microcannula. So fillers, to me, there's a real risk when you are using a needle when you inject, because you can create lacerations of vessels, and you can create something called necrosis, and I don't want to scare you, but blindness, loss of soft tissue. In the last 3 months alone, I've had 3 of my colleagues send me disastrous photos. Sam, what should I do? I said, stop using needles. This is safety. So this is how I sculpt, is my wand to sculpt with. And if you look, there is a masculine quality to this face that's become feminized just through an office-based procedure of fillers. And that's what I think is very, very powerful. Now, if you look, your eyes are good, right? You guys can see what looks off. Look at those lips. They don't look right because they're not designed right. And if you see here, I've actually made her lips bigger, but they look proportional to the face, and there's more shape, and they're more balanced. So not 100% corrected, but that's what one ugly syringe can do, and this is what 20 beautiful syringes can do. And this is another concept. If you look, she looks more masculine on the left, and she's 35 with aging, and this is 42. Same lighting, same camera, a little bit better hair, but makeup on both. This is not trick photography. You see all these trick photographies of things where they're, heavily made up and things. No, this is 7 years later with consecutive over years of injectables, and this is filling the face in a way that I think looks softer. But how do I do it? I hit every square millimeter of the face. And this is the thing that I want you to understand, is it's not just making a cheek big, because it looks bad. There's a disjointed unpleasantness when you're looking at a face that doesn't look natural. And what you guys do is even harder, because you have to make sure that every element works so that you look your best and that you look like the gender that you're trying to achieve, and to get there requires artistry and balance of nuances all over the place. A lot of times when you're working with male surgeons, you hear their language. Their language is technician. It's, I'm going to cut on you and lift your brows 3 millimeters. I will cut this across here. But what they don't articulate is beauty, design, and taste. And so my goal is to have you understand that. So again, I had a patient of mine, she really wanted me to convey to you that there's other things to do to feminize or masculinize face, and I want to just talk about a few things. In fact, this is one of her recommendations. She wanted to look softer in the hands, and I have a lot of these before and afters on my website, but I can soften the hands and make that more feminine. And that's a very, very easy thing to do. Is to rejuvenate and balance the face, especially if the face has been rejuvenated. It can be done. Lips are done so badly out there, especially in your zeal to look as good as possible. I've worked on both directions. I've had many people come in that have a very a very feminized lip, and I can reduce it. In fact, I do more lip reductions than almost anyone in the world. And I've had several come from different parts of Texas to reduce the lip simply to make it look less feminine. Unfortunately, I don't have the before and afters because they've come in, but I have tons of lip reduction photos on my website. This is to show you the other way. If you're looking to look more feminine, you can make a lip subtly augmented, so long as it's proportional to the face and balanced to it, but also their shape. And then you can go a little more aggressively, and you can see this is slightly more aggressive, but again, natural and balanced to the face. And then you can go really aggressive and still get away with it, and here's the reason why. Your bottom lip is the one that's the key to feminize a face. I repeat, it is the bottom lip that feminizes a face, not the top. And especially as you start to mature into your 40s and 50s, the top lip doesn't look right. When you start to augment it too overzealously, it doesn't look balanced. It doesn't fit your faces. That's why when you saw that other filler that I did in that lady where I balanced your bottom lip, all of a sudden your brain said, hey, that looked natural. You know what's natural, but you don't know how to get it. And what I want to do is help you achieve that naturalness. And otherwise, you get these things that look crazy, where I've got to now cut it down and make it look normal. Or you get even worse, some bad silicone. All the other ones were my silicone work, to be honest with you, are permanent if you want permanent, but this is bad silicone, and this is my correction where I think the person looks more proportional. That's there. And then facial slimming, you can do obviously bony work, and I don't do bony work. I really respect those that do it. I think it's fantastic. You got to know your limitations as a surgeon. But this is just showing you Botox, and this I am very good at. I do this all the time, especially if you've got clenching or TMJ issues. I just had a lady today that told me she hasn't had a headache in 6 months since I've done it, and it's been a miracle. Or this is the opposite, is if you want to masculinize a face, it looks like I did a jaw implant. No, this is a permanent filler called Artifil done in 10 minutes, and you can strengthen, and it looks like bone. And so this is something that's so easy to do. I strengthened the entire jawline, including the chin, all done non-surgically in a few minutes with a permanent filler. So I leave you with the thought of, when you seek a surgeon, when you're working with a surgeon, listen to the language that person uses and listen to how that individual communicates with you, because what I'm really, really passionate about is to help you achieve your goals and do so in a very sensitive way, and my staff, I believe, all are sensitive to your needs, in a way that is artistically beautiful and that will keep you looking natural and not do things that don't look right. So I thank you for your attention tonight, and I'll entertain any questions. Yes, let me close this off.
Okay, I've been hearing about